Morning to you all. My name is Dr. Omari Francis, coming to you from City Health Hospital. Probably I'll start again by explaining where we are actually located. We are located in Odeon Cinema. That is a building that is located in Tomboya Street, first floor building. That is actually where we have the facility. I want us to have a brief talk as regards to matters COVID-19. All right, this of course in and about matters COVID-19, and it's not quite a new thing. It's not a new concept. Every day we are getting to have new information coming in, and it's important to actually highlight specifically on some fears, specifically to be able to highlight on things that people are able to do to just make sure that they are actually safe as they go about their activities from day to day. All right. So with the assumption being that we at least have a bit of an understanding as to what COVID-19 is, that is to say coronavirus disease, yeah? Maybe it's not proper that we just make assumptions. Coronavirus disease, that is a disease that is actually caused by what we call SARS-CoV-2. That is actually the strain of the virus that is causing quite a bit of havoc around. With which you're finding, of course, the symptoms for it more or less aligned to flus, with things like coughing, with things like sore throats, things like sneezing, things like fevers, things like joint pains, things like some even actually portray issues like loose stools and whatnot, right? So the symptomatology is more or less aligned to what you'd expect from a standard flu, although and specifically to that you find that as you would find with the standard flu, of course you have variations from mild, moderate, even to the severe forms of the disease. That is actually also the thing that we're actually seeing being mapped out as regards to the COVID-19. So my purpose of engaging this conversation is probably to actually highlight on what you are able to do to prevent against potential infections, to be able to highlight on things that will allow you to go about your activities, reduce the heightened fears that we are seeing, because there's quite an amount of fear with people. And I usually find personally, one of the things that I usually say is fear is something that stems from not having understanding. Fear is usually something that stems about from when you don't have enough information to go by. Then yes, absolutely, you do actually get to have a bit of fear pretend. So as regards to the same, you find that now we are able to actually speak about what actually causes COVID-19, the disease, that is, how does it spread about, what are the facts around that, what are the things that you're able to do to secure probably you as a person, and if you're in a company, what also at the company level, managerially speaking, they're able to do to make sure people are actually going about their activities in a good way, right? So how does it spread about? Okay, of course, it's what we call person-to-person contact, all right? That is where you find that now a person is able to produce droplets, respiratory droplets, that is, either by design of like either coughing or by sneezing, so that you find that those droplets are actually released. And you find that because of the heaviness of those droplets, they're only able to travel about probably about 1.5 meters, all right? And that is why you find that the whole issue about social distancing has actually been implemented. When you think it out in that manner, you'll find that there is an explanation for the same. So social distancing is something that has been calculated, and it's been found the droplets that carry COVID-19 don't really go that far off, all right? So if you're able to sustain that and you're able to maintain that, you are already on the right track, all right? And number two, you find that by contamination, okay? Contamination could be like on like surfaces and things like that, and actually that is also a very common way of actually spreading about. And when you find that now that has actually been understood, the thing that we put to people is to keep cleaning surfaces. Depending on how busy a place is, for example, you have a business that is actually open, how many people are frequenting that place per time? How many people do you have? If you probably have employees working in that space, how many people do you have around that? Because dependent on the number of people, the number of activities that are ongoing, you usually find that those are the things that which actually will determine how frequently we have to keep cleaning, all right, by disinfecting and all these different things. The other issue is, of course, in personally, you find that they're respiratory wise, there are things you're able to do. Like you can see, I'm having a mask on. Probably it's pulled down, but that's because the person behind the camera is quite a distance off. But the idea is you find that you should be having a mask on, and not only that, just make sure the mask that you're having on is actually functional. It's very easy to tell how functional a mask really is, all right? All you have to actually do is just pull it up, okay? You pull up the mask and you maybe get a lighter and try and blow against, right? With the ease with which you're able to, probably if it's a matchstick with which you're able to put out your mask, will always tell you how good your mask is actually, right? So because you find that some of the designs we are having on the swing of the streets are just exactly that, okay? It's just a clothing with no filter whatsoever. So you need to make sure that there's actually a filter so that you don't just have something that is not protective for any purpose. All right, so if you're able to do these things, you find that you're already a step ahead. Okay, the other issues, definitely, how do you also prevent contamination? By hand washing. All right, it's something that has been so spoken about. Hand washing, hand sanitizing. All right, the more frequently you keep washing your hands, remember, as the information has been circulating, you find that the design of the virus, the outside design of the virus, is actually lipid in nature. That is to say, it has can I call it fat? All right, let me just use the word fat for easier communication. You find that now that one with soap interaction usually destroys. So just that simple act of washing hands is quite effective. All right, so sometimes you find that we even advise more of hand washing than sanitizing, because sometimes sanitizer are actually sticky, and in a way, yes, as much as they're effective because it's alcohol, you find that that stickiness sometimes in itself can actually predispose to things sticking to your hand. So a whole lot of washing of the hand and putting on your mask is been found to actually be effective up to about 90 to 95% effectivity if they are used the right way. Okay, so I think that is very important in a very simple term that has actually been understood for what it is. Now, what do you do in the workplace? What do you do as you're going about your activities? I mean, those things we've already spoken about are the things that now we stretch out and we actually expound on the same. Say, for example, if you're in a working space, you should, for example, flu-like symptoms. What exactly should you be doing? All right. So, for example, we find one of the easiest things that we are advising people to make sure they have in their facilities is what we call disposal bins, right? So maybe the person behind the camera will be able to show what an example, a model of a disposal. So you find that, all right, so that you don't have to keep touching it. Just by using your foot, you're able to open it, so that if somebody is having flu-like symptoms, maybe they're having running nose, maybe they're having a bit of a cough, maybe they're having all those things, nasal congestion, by use of like a tissue paper, they are able to discard it properly, because it has a lid. Okay, so it's as long as you're able to get that and so basically dispose it the right way, you find that you should be safe, and the people around you as well should actually be safe. And it's important to adhere to that. If you're in a working premise, also maybe probably it's important to put about stickers that emphasize on the importance of things like cleaning, right? So just to imprint that, just to help people to remember that they need to be washing their hands and all these different things. If you're sneezing, what is the right way to sneeze? For example, if you don't like have a tissue paper, understand that just the simple act of sneezing into the fold of your arm is actually good enough. All right, so we discourage, once you use your handkerchief and you dispose it on the one time, you find that the act of using that it's become contaminated, and you put it back into your pocket, and the next time, even if you clean yourself afterwards, it's a self-defeating thing. So it's better when you're using like a tissue paper, all right, so that once you're done with it, you dispose of it. If you find that the only thing you have available to you is a handkerchief, then it's supposed to be a one-off. You use it one time and you dispose of it properly. It's very important. As long as you're able to do that, you're already doing well. Things like handshaking and things like that, those are things that already I probably find that a lot of people have an understanding into that by now. And I've seen people become very inventive with different ways of sort of like saying hello. By some people are even choosing to do like ankle clickings and things like that. Just anything else, but the issue of proximity has to be that importance of social distancing is important, that it has to actually be implemented as you go by. Whatever it is you're doing, make sure you stick to that. Now, if you're arranging for things like gatherings, you are arranging for things like meetings, what exactly are you supposed to do? Make sure, again, as I started by saying, you find that you must have the disposal bins at the ready. Okay, so that in case anyone comes in and they are, suddenly they are ill and things like that, they know where they're actually supposed to dispose that which needs to be disposed. Make sure that your place has enough of water running. Okay, maybe sinks and things like that can be put about. Hand sanitizers where sinks are not applicable, make sure those things are readily available to the people that are supposed to be gathering together. Make sure the arrangement of the place that you're meeting is sufficient, in the sense that you find that at least the arrangement of the seat is supposed to be about a meter apart. So anything closer than that is not really ideal. And you find a lot of places there's a limit of about 15. But if it's a big place, if it's a big hall, you probably there's a bit of laxity that can be allowed into that, as long as you're making sure that the place is well aerated, the place is well ventilated, and the whole dynamic of social distancing is actually implemented. Where you're able to do what we call teleconferencing, it's highly advised so that you avoid physical to physical meetings. I mean, we are now having a lot of people embracing Zoom meetings, okay? And it's something that people should be thinking about as you go forward. And it has been found to be of help, even financially, really. If you really think about it, there's a lot of things that are people are actually benefiting from the aspect of not having to meet physically, really, okay? So the other issues that we find is very important is have an understanding that you need to probably, if especially you as an employee, if you are standing in that capacity of an employer of managerial capacity, you need to start thinking of having an isolation room, so that if one person falls ill while they are actually at the workplace, you're able to isolate for them. And also it's important, if you're able to actually have like a health facility, have a talk with one of the health facilities that is closest to your working station, so that you are able to have that communication as effective and as fast as is possible. So that if you are having these things that you actually querying might be flu-like, might be COVID related, you're able to call into that facility, you're able to have them pick up the patient as soon as possible, you're able to coordinate, whichever way. You can actually ferry the patients yourself, whichever way you feel most comfortable, but the idea is an isolation room so that you prevent a lot of interaction, and then an extraction so that this patient, in a very good way and in a very professional way, they're able to actually be carried and taken to hospital so that further investigations are actually done, and yeah, to make sure that the people actually benefit the best. And also, if people are having flu-like symptoms, it's also probably best that they stay home, isolate for a bit, especially when you're having things like coughing, having things like sneezing. All right, those things that are really sort of define your toxicity to be on a higher scale. It's important that you self-isolate probably for about a week, if not about 10 to 14 days, to make sure those symptoms are out before you go back to work, before you start reconvening with other people. And you find that if those things are implemented the right way, they should actually allow for people to work in that space where there is a bit of safety, and so that you don't have to be very fearful. All right, fear has already taken quite an amount of space in this country, and it's important for us to now start tackling these things from a point of, yes, you understand this thing is actually there, and you're taking all those measures that have actually been put up, but you're also able to be productive at the end of the day. I mean, productivity has been one of those things that has actually even brought about mental issues on time, stress elements and things like that. That is not the point of discussion of this meeting. It's just to highlight the importance of blending these two things as we go by. I'll reiterate, as I started by saying, this is City Health Hospital. My name is Dr. Francis Omari. That is the small sort of precept that I wanted to give as regards to matters COVID-19. For further information, you're able to call into the facility. We have our numbers up. You're able to visit different social media platforms, things like Facebook, Instagram and all this, and you're able to actually pick up our numbers as you go by, and we are very happy to guide you through. If you have questions, if you have things that you need demystified, we are hearing of people claiming things like alcohol are good for that. Of course it's not, but if you have such questions, if you have fears, if you have things that are actually holding you away from potentially being able to do one or two or three things, you're able to call in either physically, or we're able to do what you call medicine, where we actually just do the consultation online and we are able to handle you properly. So that is as far as I wanted to share for today. I want to wish you all the best day. Be blessed.